Time now for The Clash. At long last, Brits who test positive for coronavirus will no longer be legally required to cut themselves off from the world. From Thursday, the requirement to self-isolate will be axed, along with remaining COVID restrictions and what's been dubbed Freedom Day 2.0. Among the other changes will be the end of free mass testing for the public from April, as the government enacts its plan to live with COVID.
What we are doing, Mr. Speaker, is moving forward in a balanced, sensible and proportionate way. Moving forward away from legal compulsion in a way that I think the British people understand, and trusting in them and trusting in their great sense of personal responsibility.
Those who are vulnerable to COVID will also be offered another booster jab this spring under plans Boris outlined in the House of Commons this afternoon, which critics have held up as a stark reminder that the pandemic will never be over for some. So is Boris right to axe all legal COVID restrictions, including the self-isolation rule? Tweet me at GB News, and you can email me at dan@gbnews.uk. But first, to battle it out, I'm joined by Professor John Aston, former Director of Public Health for the North West, and Dr Steve James, the consultant anaesthetist at King's College Hospital, who went viral after challenging Sajid Javid on those jab mandates for the NHS. Steve, great to have you back. You don't think Boris Johnson has gone far enough today?
No, I don't. I would suggest that if Omicron had been into society in January 2020, if we had the level of immunity that we've got in society, we wouldn't be producing any rules like we've got now. And that would imply that we wouldn't be making differences between vaccinated and unvaccinated people. We wouldn't be having the PLF still, and we wouldn't be testing in the ways we're testing. We'd be testing based on symptoms, and we'd be providing support for the vulnerable and those at risk.
Professor Ashton, isn't it time to just say, as Steve says, scrap all of this? We just don't need it anymore.
Well, I think, the Prime Minister's made a political judgment, and what we have to do now is to do our best to make sure that it's the right answer. There's been quite a lot went on behind the scenes today. I think making sure that the Office of National Statistics carries on doing the surveillance so that we know what's happening. I think that's really important that we do that. We need to know where the virus is, what levels it's at. We need to really now encourage the public to do the right thing. And if they are feeling unwell and maybe have COVID, to not put other people and their families and friends at risk. And we need to make sure that the local public health systems, which were not in a good way when the pandemic arrived, but have been built up over the last 2 years, that they're kept adequately resourced so that if there is another wave, we're able to respond to it. So I think, I'm living in the practical world of what do we do now that, the government of the day has decided on a course of action, and we need to make sure we keep people as safe as we can.
And you like, Professor Ashton, you like these sort of vaccine passport mandates, that sort of approach, because I believe you've seen them operate in France.
Well, I just got back last night from France, visiting my son and his family. And, it was very noticeable that, for one thing, almost everybody was wearing masks on the street and in public places and so on, and that the passport system was in operation if you went into a bar or a restaurant or a station, and it was just very calm and everyone was just getting on with it, and life was very normal in France, and I think it felt very comfortable.
But Steve, do cloth masks actually do anything? Because I've looked at lots of evidence that suggests they're pretty useless at stopping the spread of COVID, especially Omicron.
Cloth masks are pretty useless at stopping the spread. Surgical masks will be somewhat better, but the evidence has always been more that they're there as a splash guard rather than to stop onward transmission. But the main point is to understand the difference between people who are symptomatic and not symptomatic, and between those who are susceptible and those who are not. So, we've got to start nuancing. And I agree very much with what Prof. Aston just said about looking at the data. But we've got to look not only at the data for future COVID problems, but also future problems from COVID measures and have those in balance.
Because, Professor Aston, I look around the world and I see the complete mess in France. I don't view it as a happy place. I view it as a segregated society. I view Canada in the same way. I view New Zealand in the same way. Do you not worry about the divisions in society created by these mandates?
I wasn't aware of any divisions in a week in France last week. It was very relaxed, very comfortable. I don't really understand what your basis is for that.
Well, because the unvaccinated have been banned from large parts of society in all three countries, including France. So there would be no unvaccinated people around you, for example, in your restaurant that you were going to, for example. I mean, many scientists believe that's the right approach. Do you?
But the economy, wherever we went last week in France, the economy was humming.
Yeah, but what you're not seeing is the people who can't take part in that. I mean, I've been on the phone to friends in different countries where these restrictions are stronger, and they're feeling extremely suppressed. They actually they're debating leaving the country they live in because of these rules. They're questioning their own sanity, and they can't go out to work or socialize. And, if you're not in that group, it seems that no one seems to think about those people.
Well, I wouldn't want to get into a row with Dr. James here. I mean, the fact of the matter is that 80% of the population support the measures, and it is a small minority of people who've been, for whatever reason, whether it's religious or anti-science or whatever, have been against, mask wearing or vaccination. And I think we can't allow ourselves to be dictated to by a minority.
But Steve James, you would say that actually your position is based on science. It's certainly not anti-science.
Yeah, my position is not based on religion or being anti-science. Life is involved in the practice of looking after patients, where science is very important, and we're not being guided by religion. The infection rates for both the vaccinated and the unvaccinated were pretty similar. In fact, the vaccinated rates were higher. So the evidence that the vaccination is stopping onward transmission just isn't there with COVID. So I don't see how that's anti-science to say that, because that's what the data says.
Professor Aston?
Well, I think we can see the major success that the vaccination programme has been, and it's given the Prime Minister the confidence to take the measures he has today.
Yeah, and I think that the primary, the main thing has been the reduction in severe disease, but not present to reduce transmission, and that has to be acknowledged.
Professor Aston, how do you feel about the government essentially seeming to halt the mass rollout of booster jabs following the third jab? Today, it has been announced that it will only be offered, the fourth jab will only be offered to those over 75 or those who are immunosuppressed over the age of 12.
Well, my understanding from the Prime Minister's statement this afternoon was that they have ordered sufficient vaccine to be able to extend the programme again if that's deemed to be necessary. But the logical first step here is to add in a further booster to the most vulnerable, and that seems entirely rational.
Steve James, I think this was the correct decision today. It's highly questionable, in my opinion, whether we needed such a major booster rollout in the first place, given it didn't stop many young folk getting Omicron. But it feels like this is a much more sensible approach to the long-term vaccination rollout, doesn't it? Focus it on the highly vulnerable and the very elderly, the two groups most vulnerable of dying from COVID-19.
Yeah, it's a recognition that hasn't had enough prominence, I think, from early on. I think it would be very sensible to look at actually doing some studies where different groups are offered the option to take the vaccine or not take the vaccine, or to go into a trial of vaccination versus unvaccination. And then we can actually see what the total benefit of vaccination program is, whichever stage it's at. Especially because if we don't really know, let's look at the data. I think many people would be willing to take part in that, where there's a question. It's difficult when we've been told that everybody, up and down to sort of children of age 12 need a vaccine, and children between 5 and 12 can have a vaccine. For people to believe that they don't all just need more vaccination. So we've got to actually evidence that and look at unwinding the pro-vaccination message that's gone on through the country. I'm very much for the vaccine for the groups where it's clearly benefited them, but I'm talking about those at low risk and those of a younger age.
OK, final word to you, Professor Aston, on the vaccine.
Well, the vaccine has been a boon, and I think Dr. James is very much in a minority among the medical profession. OK, that was former Director of Public Health for the North West and author of Blinded by Corona, Professor John Aston, and the NHS anaesthetist, Dr. Steve James. Thank you both. So who do you agree with? Well, Keith on Twitter says, good on Boris. We can start to get back to normal. If it was up to Keir Starmer, we would all be locked down again. I agree with that. Nikki via Twitter says, Boris can hardly ask us to follow any rules now. He has no choice but to drop them all. And Stephen says one of the biggest issues is overturning Project Fear. People listened to the apocalyptic daily briefings and the majority meekly gave up personal freedoms. At last, we can now open up, relax and learn to live with COVID, unless, sadly, you live in a devolved nation.